The side effects of marijuana, again, we want to be careful how we categorize side effects versus effects. I like just calling them all effects because it's going to depend on each individual whether they consider it to be something that they consider to be useful or not. And so there's automatically a kind of a judgment that we place when we call something a side effect. Sometimes we can say primary effects, but even that doesn't really work when we get into the real world, because what happens is one person will take marijuana, and depending on what is going on with their own physiology, it'll affect them strongly in one way. They'll get predominantly one symptom, and another person will take it, and it'll be something very, very different. So this is one of the things about marijuana particularly that's very, very interesting, is that it affects people differently, but it also tends to go into areas where the person has a weak link in their armor or a weak link in their physiology, wherever that may be. And actually, depending on how you use this quality with marijuana, it can be very beneficial or it can be very detrimental. If you use it in a balanced way, then you can use those symptoms to exactly diagnose what's going on with you, and then you can also find out what to do to balance the whole situation, including marijuana if that's your choice. But if you don't do that, then what happens, if you don't use the marijuana in a balanced way, what happens is the marijuana just goes into that weakest area and it begins to needle and hammer on that area, and it will get worse and worse over time. So that's why I advocate balancing and learning about the marijuana syndromes, because when you learn about the marijuana syndromes, each one of those is a whole encapsulated arena of knowledge that tells you exactly how to balance where you are with your relationship with marijuana.